Hello, so this is a very commonly asked question that patients ask me. What are the different types of facelifts? What is the best facelift for me? Well, this video is really going to go through that in some detail. And so first of all, how many different types of facelift are there? Well, many different types have been described, but we can really categorize these into approximately 7 different types. And so I'm going to talk you through each of the 7 different types of facelift. What are the benefits of each one? What are the downsides of each one? And I will go through this step by step. So first of all, why does this matter? Is it important? Well, in terms of the concept of the word facelift, if you have facial aging, which might involve loose skin, sagging along the jawline, changes in your neck, volume loss, sometimes this is best corrected with a facelift. But what are the different types? And why does it matter? Is there such thing as a non-surgical facelift? And is there such thing as a quick fix? Are there procedures that are associated with less recovery and faster healing? What are the potential downsides of the different facelift techniques? Are some more natural looking? Do some hide scars better than others? And what about these other kind of catchy names like threads and stem cell facelift and radio frequency? What are the contexts that these advancements can be used for? So, a little bit about myself. My name is Dr. Julian De Silva, and I practice at Harley Street, where my experience really is from working in London, Los Angeles, and New York, and I specialize only in the face, and I'm an oculofacial cosmetic and plastic surgeon. And most of my practice is around eyelid surgery, blepharoplasty, face and neck lift surgery, and rhinoplasty, nose reshaping, and associated techniques that help those procedures. A good proportion of my patients are revision patients, from patients who've had surgery elsewhere, and I've completed thousands of procedures in this area of medicine. So, a little disclaimer, this information is to help provide information to you, but it does not constitute a doctor and patient relationship. So first of all, what's the first type? A non-surgical facelift. What does this actually mean? In essence, it means avoiding surgery. So non-surgical techniques could be things such as Botox and fillers. There are also more sophisticated devices that use ultrasound, radio frequency, and these essentially are tightening the skin. What are the advantages of these techniques? The advantages are they avoid surgery. So generally they have a much faster recovery, and patients can look good even after a few days after having a non-surgical treatment. And really they're suitable for patients who have really quite early changes, and they may be a bit more focused around losing volume and volume loss, but they're not going to address gravity, and they're not really going to address loose skin, and so they're quite limited in what they can achieve. But the main advantage is that they have a fast recovery and they avoid the need for surgery. And so usually they can be completed under local anesthetic, sometimes with topical anesthetic. They don't need sedation or general anesthetic, but then their effect is a little limited. Now we've all seen celebrities and people who've had a little too much non-surgical treatments, and usually this is in the form of fillers, adding too much volume to the face. And here with this photograph of Nicole Kidman, we can see attractive, youthful appearance with a very kind of V-shaped jawline, which is one of the characteristics of a natural and youthful jawline. And then this photograph, it just shows more volume in the lower third of her face, which if anything reduces that slim V-line and makes her face just fuller, and if anything a little squarer. And so, like many things in life, a little bit of volume, a little bit of filler can be a good thing, but a little bit too much, and then it doesn't look as natural. The other limitation with non-surgical treatments, well, they don't tend to last that long, and many treatments don't last more than 6 to 12 months, and then they require repeating, and they require a degree of artistic talent in order to ensure that they look natural. So the second type of facelift is a skin-only facelift, and this really means what it says, and it has other nomenclature. Sometimes it's called a ponytail lift and other kind of catchy names, but essentially it means it's suitable for patients who just have a very small amount of loose skin, and those patients can benefit from a smaller surgical procedure that essentially just takes away a little bit of that loose skin. And so it's not lifting the structures of the face beneath the skin. And in a way, it's important that it's not used in patients who have more facial aging, as it's only going to benefit patients with loose skin. So the advantage is, well, this kind of facelift is going to benefit patients who have a little bit of loose skin and mild facial aging. The disadvantage and the advantage that come alongside that is it requires minimal anesthetic, maybe done under local anesthetic. Patients are going to have fast recovery with maybe only a few days or a week of recovery or downtime. The disadvantages are, well, it is dependent on the fact that there's no further facial aging, because if there's any effects of gravity or there's effect of more loose skin in the neck, well, it's not going to give the result, because it's not going to lift those underlying anatomical features, which means that it can give a more stretched appearance. And that was the downside of the very early techniques of facelift surgery. It tended to give very kind of stretched lines in the skin because it focused on lifting the skin and not the net layers beneath it. So in summary, well, it's a technique that does have an advantage for a small number of patients with early facial aging and a little bit of loose skin, but for many patients, it's not going to be adequate. So the third type of facelift is a max facelift, and this is a rather fancy name for minimal access cranial suspension. And this technique really focuses on using 3 stitches to lift the face where it has descended and remove loose skin. So in surgical practice, it's a relatively straightforward technique. And the advantage of that is it does produce good results, it does make an improvement, but it is really dependent on patients having relatively mild facial aging and relatively little changes in the neck area. And so the advantage is the fast recovery. It can be done in relatively light anesthesia, local anesthetic with sedation. The disadvantages of a max facelift, well, it tends to be less effective in the neck area. It doesn't contour the neck in the same way, and it doesn't tend to effectively remove loose skin in the neck area. The fourth type of facelift is a mini facelift, and really this is half a face and neck lift. It means what it says. And so the scars are really limited to an area in front of the ear. So there's no scars going behind the ear. And because of that, the main advantages are for patients who have facial aging in the lower third of their face. You might have some effects of gravity with jowls, soft tissues from the cheek just descending down and creating more fullness along the lower jawline. And so a mini facelift will just lift that area back up and smoothen out the jawline, and the scars are concealed around the front of the ear and within the hat. And this technique means that there's no surgery behind the ear and there's minimal surgery in the neck area. And so because it's a mini facelift, well, it takes half the amount of time as a full face and neck lift. And so the recovery and the healing is also much faster. The swelling will be less, and the recovery may be in the order of 1 to 2 weeks in terms of the majority of the swelling and majority of the healing occurring. The downsides of a mini facelift is that, well, if there are changes in the neck, such as bands in the neck, or if there's more loose skin, or patients need additional techniques to give the best result, well, it won't give the very best natural result. There are also variations in terms of descriptions of a mini facelift, techniques such as described like an S-lift, but they're all variations on the same concept. So a mini facelift absolutely has an advantage for some patients, but there have to be relatively mild to moderate changes with less changes in the neck area. And then the fifth type of facelift is a SMAS facelift, and this is the commonest type of facelift completed by plastic surgeons. And this technique absolutely improves the lower third of the face, it lifts the area of the face, it improves the neck area. Now, most of the direction of pull tends to be in a lateral direction. So in this picture, it's illustrated with this blue arrow. So most of the lift is working in this direction, which improves the jawline and the neck. It does require anesthetic, either sedation anesthesia or twilight anesthesia or general anesthetic. It will be associated with some recovery, including swelling, sometimes bruising, numbness, the feeling of tightness, and you really need a good 2 to 3 weeks, if not a little bit longer, for most of the swelling recovery to occur. The main disadvantage of this technique, well, it is a procedure that does involve surgery. There will be a recovery time associated with it, so you need time dedicated for that. It does result in a lateral lift, and so that lift is not necessarily a natural lift, because most of what changes with gravity tends to be in a downwards direction, and so the lift is not so natural because it's pulling more in a lateral direction, and sometimes additional procedures are needed, like in the cheek area, in order to restore the volume in that area. So the sixth type of facelift is a deep plane facelift, and this facelift, well, it really says what it is. It lifts the deeper layers of the face, and it lifts in a vertical and upward direction. Now, a lot of the changes that happen with facial aging are associated with gravity and tend to be in a downwards direction. So this type of facelift really restores the natural volume in the cheek area by lifting this area up, and restores a more youthful V shape to the jawline. So it's a more natural kind of facelift. The challenges with this, it's a more sophisticated type of technique, and so less than 5% of plastic surgeons complete this technique, and it is a technique that definitely offers a more natural appearance because it restores more of a V-shaped jawline to the face. It can be used in conjunction with other techniques and the use of the golden ratio to give more of a natural result. I personally prefer this for patients who have further facial aging in the face and the neck, because I believe it gives faster recovery and less swelling associated with the healing process. So the seventh type of facelift, well, in a way, this is a more sophisticated technique in terms of patients who have additional need in association with their facial characteristics. So, for example, this lady has a very full neck that shows her neck starting almost where her chin is. And this lady, even in her 20s, had a fuller neck. And so part of the reason for this fullness is there's like deeper soft tissues, often the salivary glands, rather than being tight underneath the jawline. Well, the salivary glands have just descended in the neck, and often there's deeper fat layers within this neck. So in order to create this really sharp angle between the jawline and the neck, well, it requires deep neck surgery, shaping of the underlying salivary glands and deep fat, and that will give a very good neck contour. The downside is it's associated with more swelling and more recovery, and so patients need to be made aware that absolutely all swelling will disappear, but this kind of surgery will have a bit more recovery associated with it. Then there are patients who might have like a smaller chin who will benefit from a chin implant. There are other complementary techniques. Patients who have a lot of aging of the skin or sun damage are going to benefit from either resurfacing with lasers or radio frequency like the Morpheus. And there are techniques that can also enhance the recovery, such as use of regenerative medicine. So in summary, well, we've talked about really the 7 core types of facelift surgery. And just to recap these, well, we've got a non-surgical facelift, which is not a true facelift, and it can use different kind of tools and equipment in order to non-surgically lift the face. And the limitation is it's really like in early facial aging that these techniques are going to be used, and it requires artistry to avoid over-treatment and overfilling of the face. We talked about the second type, a skin-only type of facelift, which really benefits patients who only have very mild skin laxity, and it just requires just tweaking that little bit of excess skin. The third type, the max facelift, which is a technique that is relatively straightforward. It uses 3 stitches to lift the face, and its limitation is really in the neck area in patients who have more loose skin. The fourth type, the mini facelift, well, this really is a technique that benefits patients with early to moderate facial aging, and it won't really enhance or improve changes in the neck and bands in the neck. The SMAS facelift, which is the core facelift that most plastic surgeons utilize, well, this absolutely makes a difference. Its vector tends to be more in a lateral direction, but it is associated with a degree of recovery from swelling and bruising, and so patients need time to recover from this procedure. Then the sixth type, my signature deep plane facelift, well, the deep plane facelift definitely lifts in a more vertical direction, and so it tends to produce a more natural result in a more V-shaped, youthful jawline. There's some evidence that it results in less recovery time, less swelling, less bruising. And then the seventh is other techniques. Patients who might have a full neck, which is just a result of genetics inherited from their parents, well, this requires a bit more surgery in this area to give the best possible result. So in summary, these are the 7 different types of facelift procedures. How do you choose what is the best technique for you? Well, it can be a challenge because even with this information, each person's face is very much unique, and so the technique for facelift surgery very much has to be customized to your individual needs. And so you do need to do some research and have some knowledge, and I hope this video has helped you in that regard. You do need to see a specialist who's doing a lot of facelift surgery, who's going to be able to guide you on what's going to be the best for you in terms of give you the best result and give you the fastest recovery. There's a degree of experience and artistry with facelift surgery, and there's no technique that is going to suit every single patient. And really there is no quick fix. And it would be great if there was just one simple technique that would help every patient, but really there's no such thing. So good luck in your search, and if there are any other questions or thoughts that would be helpful, please make a note on this video. If you'd like to sign up for my newsletter, please do that, or if you'd like to attend in a consultation, I'd be very grateful to help you either virtually or in person. I hope this video has been useful for you. Thank you for watching.